How do you know if you have acute Lyme disease? It can be really hard in the early days of infection to get clear information on whether you actually have contracted Lyme or not. But here's a couple of clues that I can give you. If you know that you have been bitten by a tick, there is a fairly high probability that you have been exposed to the Lyme bacteria, which is called Borrelia burgdorferi. So step one is always keep the tick and get it tested if you can. But the things to look out for in the early days are, one is a bullseye rash. And a bullseye rash, also called an erythema migrans rash, looks like a target. It literally looks like the logo for the Target store. Red circle in the middle, then a central clearing, and then a red ring around the outside. They don't always appear as that perfect target, but that's kind of what you're looking for, is what we call the bullseye rash. If you have a bullseye rash, you have acute Lyme disease and need to seek care. The other thing to watch out for is flu-like symptoms, fevers, headaches, joint pain, numbness, tingling, neurological symptoms starting to come on. If you experience any of those and you know you've been exposed to a tick, then I suggest you get there as well. Of course, testing is not accurate in the early days, so don't rely on testing in the first few weeks. If you feel like you've been bitten, if you have any symptoms afterwards, flu-like symptoms, or if you have the bullseye rash, you need to get treatment.